Hello, my name is Ayat, and today I will be presenting on the use of repetitive transcranial magnetic stimulation, or the rTMS, in the treatment of post-traumatic stress disorder. In the slide, we'll be talking about the PTSD and the rTMS. PTSD is a serious mental health condition that develops following trauma, standard treatment such as psychotherapy, medication, and effective but not universally successful. In the recent years, rTMS has emerged as a promising non-invasive brain stimulation technique. In this presentation, I will review PTSD causes and symptoms and explain underlying neurobiology, introduce the rTMS and the physiologically effects, critically analyze the events for the use of in PTSD, and suggest a future research direction. In the slide, we'll be talking about the causes and the risk factors. PTSD happens when someone goes through a very scary or a painful event, but it doesn't affect everyone in the same way. Things like war, assault, or natural disaster, it can cause it. Some people are more at risk because of their problem genes or stress hormones or not having enough support from family and friends. In this slide, it is all about symptoms of PTSD. PTSD symptoms are divided into four main groups. The first group is intrusive memory, which means upsetting thoughts, flashback, or nightmares about the traumatic event that comes back again and again. The second group is avoidance behavior, where a person tries to stay away from places, people, or activities that reminds them of what have happened in the past. The third group is negative changes in the mood and thinking, such as feeling sad, hopeless, guilt, or losing interest in things they used to enjoy. The fourth group is being on the edge, which means feeling jumpy, easily getting angry, or having trouble sleeping. Those symptoms can make it very difficult to live everyday's life, like working, studying, or keeping a relationships. That's why it is so important for people with PTSD to get effectively treatment and support. In this slide, we'll be talking about the PTSD neurobiology. Brain scans shows that PTSD affects a certain parts of the brain. That medulla becomes overactive, which makes fear response stronger. The prefrontal core, it becomes less active, which it makes it harder to control emotions, and the hippocampus becomes smaller, which causes problems with memory. On top of this, the body stress symptoms called the HPA axis, it doesn't work properly. All of those changes together leads to a strong fear, poor emotion control, and memory problem. In this slide, we'll be talking about the rTMS and the techniques that have been used. rTMS is a treatment that uses magnetic coil to make a small electric current in a specific part of the brain. It immediately targets the dorsolateral, the prefrontal cortex. Is an area that helps with thinking, controlling emotions. By stimulating this area, rTMS tries to bring a brain activity back to normal in the currents specific that are disrupted by the PTSD. In the slide, we'll be talking about the effects of rTMS. On a body level, rTMS changes how active certain brain areas are. It makes the brain cells more flexible and it helps them form a new connections. It also affects the release of a brain chemicals that controls mood and the stress. Most importantly, rTMS helps to restore balance between the prefrontal core, which controls emotions, and amygdala, which creates fear. This balance is a very important for people with PTSD. The evidence of rTMS in PTSD. Research on rTMS for PTSD has shown mixed results. In some studies, find that it's a greater reduce symptoms, especially things like flashbacks and feeling on the edge. Another study shows only small improvements. For depression, rTMS is already approved as an officially treatment, but for PTSD, the evidence is still growing and not yet as strong. In this slide, we'll be talking about the research. The strength of rTMS includes being non-invasive and genuine well tolerated. However, there are limitations. Many studies use small sample sizes, treatment protocols vary, and the long-term outcomes are unclear. This highlights a gap that future research must address. For the future research direction, future studies should study rTMS in combination with trauma-focused therapy, optimize stimulation, and identify neurobiology predictors of response. Large-scale, long-term trials are essential for clarify epically. Last but not least, the conclusion. In the conclusion, rTMS looking promising for treating PTSD by working on the brain changes behind the disorder. It may not be full solution on its own, but it offers hope as part of the treatment plan. Thank you for listening.